Single-payer healthcare is often thrown around as an answer to our skyrocketing healthcare costs. So let's take a look at the pay in single-payer. What is single-payer health insurance? It's a health insurance system in which the government, and only the government, pays doctors and hospitals for your health care. Advocates argue that a single-payer system costs less because the government has less overhead. Of course, I'd like to see the government operate on Blue Cross's 7.2% operating costs. Taxes, taxes, taxes. Even if the Fed saved money on overhead costs, they would still have to raise taxes. Today in America, employers and individuals pay more than $800 billion a year in premiums for their private health insurance. A government entity would have to raise that $800 billion in taxes to take over health care. In the United Kingdom, for example, their National Health Service is funded with a 17.5% sales tax on everything. No exceptions. Everything you buy, every business transaction. That's more than double the average sales tax in the United States to pay for health care. And you'd pay more money in the long run, despite no longer paying premiums out of your paycheck. Let's talk about fraud and abuse. The United States actually has two single-payer systems already in operation, Medicare and Medicaid. They are models for programs around the world, but they have a lot of fraud and waste and abuse. The GAO estimated in 2016 that $60 billion was lost or wasted in Medicare and Medicaid. Private insurance companies have a stronger incentive and more resources to watch out for and prevent that kind of loss. Delivery costs. There's also an issue with delivery costs. Medicare and Medicaid cover 135 million Americans today, but payments to docs and hospitals are too low to cover those providers' operational costs. You see that red line? That's the break-even point, where medical providers would generate enough money to pay for expenses. Private insurance heavily subsidizes the other two systems. That means if we had a single-payer system operating on either of these existing government reimbursement rates, medical capacity would go down. So we may see a drop in the number of doctors and hospitals and other healthcare providers delivering the top quality care we enjoy in the U.S. today. And that means wait times for doctor visits and procedures could go up. Straight talk is, single payer may be too costly for the American healthcare system. Instead, let's work to improve our current system and lower costs for everyone.